Mr. President, recently President Obama made the comment that Obamacare isn't just a website, it's much more. Well, I couldn't agree more with that statement. His health care law is also a list of broken promises that harm middle-class Americans. While he was trying to sell Obamacare to the American people, President Obama repeatedly stated that if you like your health care plan, you'll be able to keep your health care plan, period. Well, he didn't say that if you like your health care plan, you can keep your health care plan unless your health care plan changes, or if you like your health care plan, you can keep your health care plan unless your health care plan gets canceled. He didn't say that you can only keep your health care plan if the White House likes your health care plan. He said, if you like your health care plan, you'll be able to keep your health care plan, period. So pretty emphatic, I would argue, Mr. President, when the President of the United States says something like that, and yet just 1 month now after the Obamacare exchange rollout, at least 3.5 million Americans have received insurance cancellation notices, according to the Associated Press. And that number just reflects the number of drop plans in about 25 states. There are about 25 other states that haven't reported their numbers yet. A report by the American Action Forum cites that this number is expected to dramatically increase in the coming months. On Sunday, former White House Press Secretary Robert Gibbs conceded that it was certainly wrong for the President to claim that if you like your plan, you can keep it. The Washington Post fact-checker even gave the President 4 Pinocchios for his oft-repeated pledge that no one will ever take away your health care plan. We're now learning that it's actually only if the White House likes your plan that you're going to be able to keep your plan. We're also learning the White House knew that people would be losing their coverage. After Obamacare was signed into law, the President's administration released regulations that would invalidate grandfathered health care plans if they made routine changes. This information was buried in a 2010 regulation. And despite the fact that the administration had posted this regulation, the President continued to state, if you like your health care plan, you'll be able to keep your health care plan. At the time this regulation was released, the administration issued estimates stating that 40 to 67% of Americans who purchased insurance in the individual market would lose their coverage. The administration also stated in that regulation that by the year 2013, 39 to 69% of businesses, large and small, would lose their grandfathered plans. What the President blatantly left out of his promise was the caveat that if the federal government approves of your health care plan, then you can keep it. Not if you like it, you can keep it. If the federal government likes it, then you can keep it. But what we're finding out, Mr. President, is the opposite is true. It is a completely broken promise. Completely. What makes this issue even more startling is that in 2010, Senate Democrats voted along party lines to reaffirm that those Americans who like their plan can only keep it if it receives a government seal of approval. In September of 2010, Senator Mike Enzi from Wyoming proposed a resolution to block the way the administration was preparing to handle plan cancellations. On a party line vote, Democrats killed the resolution, effectively endorsing the administration's proposal to cancel plans individuals have and like. After breaking his oft-repeated promise, the President is now telling millions of Americans who've had their insurance canceled that they should just shop around for policies that could be more costly on a website that does not function. It's clear the administration has misled Americans with their promises. Jerry Buckley of Marion, Arkansas, says he didn't pay attention to any of that because the President kept telling you, this won't affect you if you like what you have. Despite being assured he could keep his plan, Mr. Buckley received a letter from Arkansas Blue Cross Blue Shield saying his policy did not comply with the new regulations under Obamacare. A comparable plan has a higher premium, higher out-of-pocket costs, and less coverage. As the leader of our country, the President's words matter. He needs to be held accountable for these millions of insurance plans that he promised the American people that they could keep. Simply having administration officials apologize for a broken website is not a solution. Madam President, the issues run much deeper than anything any IT expert can fix. This is fundamentally about the flaws in this law, and that's why the cancellation notices continue to go out despite the President's assertions and promises that if you like your plan, you can keep it. Well, in addition to the cancellation notices, consumers are experiencing sticker shock when they see what plans are available to them this next year. Forbes reports that premiums in 41 states are going to increase under Obamacare. My home state of South Dakota ranks 7th on that list, with premiums rising 77% on average. In 4 states, insurance premiums are expected to rise over 100%. A Washington Post headline from the weekend reads, and I quote, "For consumers whose health premiums will go up under the new law, sticker shock leads to anger," end quote. The article cites an anecdote by an area lawyer, Deborah Persico. Ms. Persico recently found out her insurance plan is being canceled due to Obamacare. Under a comparable plan with the new law, her premium is going to increase by 55%, and her deductible will double. She expects this new plan will cost her at least $5,000 a year more than she pays under her current plan. There are millions of middle-class Americans, just like Deborah, whose health care costs are skyrocketing under Obamacare. Madam President, the rising premiums are affecting both Americans who buy their insurance in the individual market and those who have employer-provided health care as well. In an effort to avoid these higher costs, small businesses are renewing their plans early to avoid requirements imposed by Obamacare. Insurance brokers told USA Today that 60 to 80% of small businesses with less than 50 employees are scrambling to renew their policies before the year's end to avoid paying the Obamacare prices for one more year. With our still sluggish economy and unacceptably high unemployment rate, Americans cannot afford Obamacare. This catastrophic law is leading to canceled policies, higher costs, and less coverage. Senate Republicans want to hear your stories. If you've had the plan of your choice canceled and your premiums have skyrocketed, we would ask you all to visit republicans.senate.gov/yourstory. It's now evident that after supporting the rule that led to insurance cancellations, nervous Democrats are beginning to recommend a delay in the individual mandate. It's clear that even those that supported this law in 2009 and 2010 are having second thoughts. But second thoughts, Madam President, aren't enough. We need to work together to repeal this law and replace it with policies that actually lower the cost of care and allow individuals to keep the plans and the doctors that they like. Republicans will continue to fight to protect as many Americans as possible from this train wreck, and we hope that Democrats here in the United States Senate will work with us. Madam President, over the weekend we saw more examples. There was a story, Wall Street Journal, from yesterday about a lady who lost her coverage and can't use her doctor. She's a stage 4 cancer survivor, and she has used healthcare facilities in her home state of California that have done wonderful things for her in treating her illness. And yet, under the Obamacare policies that are currently in place, she is losing that coverage and losing access to her doctor. The promise that you can keep your plan, if you like it, the promise that you can keep your doctor, if you like your doctor, it is a broken promise that cannot be fulfilled. And the President of the United States, over and over and over again, said, if you like your health care plan, you can keep it. Madam President, we know that's not true, and we know it's never going to be true. And we know, going back now to 2010, they knew it wasn't going to be true. They were predicting that there were going to be cancellations. They were predicting there was going to be sticker shock. And yet, never once did the President modify his statement. He consistently said, if you like your health care plan today, you can keep it, period. Completely misleading. Now, millions of Americans who have received cancellation notices and who are seeing skyrocketing premiums, imperiling their ability to cover themselves and their family. There's a better way. There was a better way back then. There's a better way today. of bringing health care costs down, making it more affordable for more Americans, allowing them to have access to the health care plan that they like and to the doctor that they choose. And yet, if we stay on this current path, we are headed for a train wreck. But we have time, Madam President, to turn the train around before this thing is fully implemented. And I hope we'll find cooperation here, bipartisan cooperation, because health care is an important issue to millions of Americans. It is a pocketbook issue that affects so many families across this country. And their ability to provide affordable coverage for themselves and their families is an economic issue and something that everybody talks about at the kitchen table. And so we can come up with a better solution to this. We should come up with a better solution to this. And if we don't, not only will we see millions of Americans with canceled coverage and millions of Americans with dramatic increases in the amount that they're paying for health insurance coverage today, we will also see the impact that this will have on jobs as more and more employers find it more difficult to retain their employees and to hire more workers. And the high unemployment rate, the chronically high unemployment rate that we see today, the historically low labor participation rate, the reduced take-home pay that we've seen for middle-class Americans, those will become a permanent state for the American people. And Madam President, I think the American people want to see us work on policies that will improve their standard of living, improve their quality of life, get more Americans back to work, increase take-home pay for middle-class Americans. This policy takes us backwards. This policy takes us down a track that leads to broken promises and unfulfilled expectations for the American people. It's high time that we change that. We can do that. And I hope that we will find the bipartisan cooperation here and hopefully the engagement of the President of the United States, who, after all, made the promise that if you like your plan, you can keep it, period, repeatedly, over and over and over again. A broken promise, Madam President, but it's not too late to do the right thing. And I hope that we will be able to find the bipartisan cooperation to do that. Madam President, I yield the floor.